Hi, welcome back to Healthy Ambitions. I'm Dr. Tammy, and I'm here with Debrah Way this week from Inpatient Rehab at Baxter Regional. And we're talking a little bit about some of the services and things that you have.
You know, I think that as healthcare reform changes, I think we need to really look at how we operate, because like we don't need a 3-day qualifying stay in the hospital to come to us. You could call me to your clinic and I could screen a patient in your clinic and give you an immediate response, like either they need rehab, inpatient, maybe they need outpatient or home health, or we can go into the patient's home and screen them and decide if they need our services.
That's wonderful, because I think a lot of people don't know that if you go into a nursing home, you have to have 3 days in the hospital of medical evaluation, which I'm not sure I really understand all of that. It just doesn't make a lot of sense, but 3 days in the hospital. So this is a really neat thing that if you need some rehab, you can just go straight in there. You don't have to be on the medical floor first and get evaluated and all that.
No, Medicare says that as long as the patient is medically stable, they can still be medically complex, like have several comorbidities, but if they're stable, they can come directly to us. And with doing 3 hours of therapy a day, getting up, getting dressed, because I'm a firm believer, coming to our floor, getting out of hospital gowns, getting into regular clothes, puts you in a mindset of recovery. And I think that has a big impact on our patients. So they're up and they're dressed and they're exercising, and by the fact that we eat in a dining room, we eat in a very social setting, you get a lot of peer encouragement. You get a lot of that socialization that is so important for how our life is structured.
Are stroke victims.
Yes,
right?
we have about 40% or greater that are strokes or neuro patients. We do some hip fractures. We do some multiple traumas. We do some what's called 25ers. It is the non-Medicare approved diagnoses, but they need us. Say the individual has had a very extensive surgery, and due to maybe a complication or two, they've been in the hospital for a while, they've been in bed for a while. We can take those folks and get them up and get them moving and get them home, and then home health can take over with their recovery there.
And we talked a little bit about before, it's about 17 days, you
14,
said? 14 days. And it's a very proactive, intense 14 days, I can imagine, because the point is to get you home and get you going.
Yeah. We have UDS data that we use, and we put in FIM scores, which is the Functional Independent Measurement Scores, that tells us how much help you have to do everything. There's 18 things we
evaluate. Like from brushing your teeth to
all the way down to tying shoes. So we put that in the computer, and Medicare.
Can you come help my son? He's 6.
Yeah. Well, I tried the M&M trick. But they tell us how long they can stay, and so we know from like the 3rd day, we know how long we've got, we know what our goals are, and we set our treatment plan then to meet that if at all possible.
And what if they don't meet that by the 14 days?
If they don't meet it, say they need 2 or 3 more days, I can extend. Medicare tells me what the recommended guideline is, but I can extend someone if I know, if I know that we're just at a hump and we need a little bit more time, we can extend them and then go ahead and discharge them home. In the event that we can't, we look at any of our local SNFs that have the subacute therapy
nursing
facilities. I'm sorry, I'm so bad about that.
Oh yeah, no, and we in the medical field all the time, these words and these things just kind of fly by us.
They do.
People out there are like, what?
Where are they at?
Yeah.
But they all the subacutes now, they have their own subacute rehab programs, which is 30 to 45 minutes a day of therapy. So, and they do 5 days a week. So if we can't get you home, we will notify the patient, and the family.
A lot of times these are nursing homes or other facilities, right?
Right, and the family chooses where they want to go, and then we start networking to help them with that transition there. And lots of times they may go there for a short amount of time, and then they may eventually be able to go back to their home.
Now, say they had a stroke while they're in the nursing home, they just have dementia or something, and they're not able to really function at home. Can they come inpatient
Sure.
with you at
Sure.
that point too? So you can go to the nursing home?
I can. And one of the things about that, say they do have a stroke in a nursing home, if they come into rehab and we're able to help them to get back to a level of independence, that reduces the burden of care in their home,
Absolutely,
which
yeah.
is the nursing home.
Yeah.
And it's all about reducing the burden of care and maintaining quality.
Absolutely.
So,
because some people would say, well, they're in the nursing home. Why are you going to
why
help
waste
them
the money?
anyway? Yeah.
Well,
but
that's
reducing the burden, exactly.
It's reducing the burden of care, giving that person back some quality and some independence. And when it comes to dealing with like Medicare dollars and stuff, everyone has worked so hard their whole life to have this level of insurance, and they've earned the opportunities that we can afford them through the inpatient rehab unit to help them maintain quality and independence. So I'm all about that.
Oh, yeah. Now, your job, we talked about this before, is occupational therapy, which is a little bit different from physical therapy because you're doing a little bit more of the...
We're more fine motor, we're more the activities of daily living. We do the feeding, we do adaptive equipment, we do a lot with adapting a task so that you can achieve it. Like putting your shoes on, you may, like one lady told me, I have always stood up to put my pants on. And it's like, well, you can still put them on, but we can't stand.
We're going to have to rethink this and do
it's something
different.
as simple as that, as just replanning how we're going to do it in order for the independence to be there. We have 3 occupational therapists that are full-time. We have 4 physical therapists that are full-time and a speech therapist. We have dedicated rehab nurses on our floor, and they're the ones that do more with the teaching and the gently pushing, because we don't do everything for an individual. We're there to help, to teach, and to foster your recovery. And that sets us apart from every other unit.
And they have to really be motivated to be there, I guess, because if they're not and they're not participating, then what happens?
Well, if, say you've been there 3 days, and if by the end of that 3rd day you have not participated, and it wasn't a medical reason, and it wasn't anything that the physician can tell me this prevented it, then I have to talk with that person about, okay, now we have to look at your next level of care. And
if you're not going to do this, then you may be.
Then we have to look at nursing homes, or we have to look at your family coming in and making a decision for you. And it's not uncommon to have to push people a little bit because there's so much grief involved with loss of function.
I think just accepting the fact that you've had a stroke or you've had a catastrophic car accident or something is huge.
It is. And we start from day one validating that. We validate the feelings. We validate everything that they share with us, because I don't go in telling them, oh, you're just going to be fine, just give me a couple of weeks.
Got to be realistic.
Your recovery is like my thumbprint. No two are alike. And I can't tell you where you're going to be in 2 weeks. I can only tell you that I'm going to do everything in my power to help you get there.
And I think it's so wonderful that you said that so many people actually achieve that and go home and do great, because just a few years ago, like you said, a stroke victim may just be bedridden for the rest of their lives, and so that really scares people a lot.
Oh, I know.
They're saying it's break time, so we're going to take a little break. We're going to come back. We're going to talk some more, and we're going to talk about how you can get hooked up with Miss Debrah if you need that. So hang tight, and we'll be right back.